Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 33rd lecture on pathology. Today's topic is infarct and infarction. First come to what is infarct and infarction. Localized area of ischemic necrosis either due to sudden arterial occlusion, localized area of ischemic necrosis either due to sudden arterial occlusion or due to venous impairment is called infarct. Again, it is a localized area. Infarct is a localized area of ischemic necrosis either due to sudden arterial occlusion or due to venous impairment is called infarct. The phenomenon is called infarction. The phenomenon is called infarction. Dear audience, suppose this is arterial, this is the tissue, and within the tissue these are the capillaries. And this is the venule. This is arterial, this is venule. You know, blood flows like this, The arterial blood entering the tissue supplies oxygen and nutrients. Then the blood comes out through the venules. If there is sudden arterial occlusion like this, no blood is in the tissue and the tissue undergo ischemic necrosis. So, this is the localized area of ischemic necrosis due to sudden arterial occlusion. Or if there is no occlusion, but there is impairment of venous return. If there is impairment of venous return, some deoxygenated blood remains within the tissue and gradually the arterial blood flow to the tissue is diminished or stopped, and in this part, due to impairment of venous return, within this tissue there is blood, but the blood is deoxygenated, but the blood contains minimum oxygen. So, due to impairment of venous return, the tissue again undergo necrosis. So, it is localized area of ischemic necrosis either due to sudden arterial occlusion or due to impairment of venous return. This is called infarct and the phenomenon is called infarction. Now, come to types of infarct. Dear audience, if you want to know whether arterial occlusion or impairment of venous return, among these two, which one is more common for infarction, which one is more common for infarct? Sudden arterial occlusion is more common than venous impairment. Type: based on presence or absence of infection. Dear audience, we know reaction of vascularized living tissue to local injurious agent, provided the injurious agent does not destroy the tissue, is called inflammation. That is, inflammation is the reaction of vascularized living tissue. There are so many causes of inflammation. One of the cause of inflammation is microorganism. So, if inflammation caused by microorganism, that inflammation is called infection. That inflammation is called infection. So, on the basis of presence or absence of infection, infarct may be: one is septic infarct. Again, infarct is the localized area of ischemic tissue. If this ischemic tissue, or if there is presence of infection in the infarct, such type of infarct is called septic infarct. So, in this type of infarct, there is presence of infection. Another is blunt infarct. Blunt infarct is that infarct where there is absence of infection. Absence of infection. Then, on the basis of color of infarct, that is based on color of infarct, it is pale infarct. The color is pale and it is due to sudden arterial occlusion. If there is sudden arterial occlusion, tissue gets no blood. So, the tissue become pale and it is also called anemic infarct. It is called anemic infarct. Another is red infarct. The red infarct, the color of red infarct is red and it is due to impairment of venous return. If there is impairment of venous return, the tissue contains blood and that blood contains minimum oxygen, that is deoxygenated blood, and due to deoxygenated blood the tissue undergo necrosis, but the tissue contains blood. So, the necrosed area is red. It is also called hemorrhagic infarct. So, based on color, pale infarct or anemic infarct, another is red infarct or hemorrhagic infarct. Respected audience, now come to pale infarct. The pale infarct is pale and it is due to sudden arterial occlusion. Caused by sudden arterial occlusion. Dear audience, again, if this is the arterial and this is the tissue and this is the venule, these are the capillaries. If sudden arterial occlusion, no blood enters in the tissue, so the tissue become pale in color. Edema in pale infarct usually absent. Dear audience, we know excess accumulation of fluid in interstitial space or in serous cavity is called edema. As there is no blood entering the tissue due to arterial occlusion, so there will be no edema, no chance of edema. Common sites of pale infarct: heart, you know, there is myocardial infarction. You know myocardial infarction is due to occlusion of the coronary artery. If coronary artery is occluded, the myocardium gets no blood supply. It undergoes ischemic necrosis and it is pale infarct. Kidney, so if there is arterial occlusion and kidney gets no blood, there will be pale infarct in the kidney. Liver, spleen, these are the common sites or organs where we can get pale infarct. Now come to red infarct or hemorrhagic infarct. Dear audience, the red infarct is caused by impaired venous return. Again, suppose this is arterial, this is the tissue, and this is the venule. These are the capillaries in the tissue. If artery is patent, no occlusion, but impairment of venous return, if impaired venous return, the deoxygenated blood accumulates here, and due to accumulation of deoxygenated blood in the tissue following impaired venous return, the tissue undergo necrosis, and this tissue is red in color. Edema usually present. Why edema usually present in red infarct? Dear audience, there are common causes of edema. You know, one of the common cause of edema is increased hydrostatic pressure in blood. As there is impairment of venous return, there is stasis of blood in the capillaries in the tissue. Due to stasis of blood in the capillary of the tissue, there is increased hydrostatic pressure in the capillary. So, there will be transudation and there will be edema. So, edema usually present in red infarct. Common sites: intestine. When there is intestinal obstruction or strangulated hernia. Intestinal obstruction or strangulated hernia. If intestinal obstruction, there is chance of red infarct in the intestine, or if there is strangulated hernia, there is chance of red infarct. Testis in testicular torsion. following testicular torsion. Suppose this is testis. If there is torsion, there is chance of development of red infarct within the testis. Dear audience, you know there is arterial supply and also there is venous drainage. Both vein and arteries undergo torsion, but why there is red infarct but no pale infarct? Again, as there is both vein and arteries, and during testicular torsion both artery and vein is affected, but there is red infarct, no pale infarct. Why? You know anatomically the wall of the vein is thinner than the wall of the artery. During torsion, the thin walled vein is affected first. So, there is impairment of venous return and it is associated with red infarct of the testis following testicular torsion. Ovary following twisting of ovary. Suppose this is the fallopian tube and this is the fimbriated end, and suppose this is the ovary here. You know there is arterial supply and also there is venous drainage. If there is twisting, both artery and vein is affected, but there is a red infarct, no pale infarct. Why? Again, the vein wall is thinner than the arterial wall. So, during twisting, thin walled vein is affected first. So, there is red infarct, but no pale infarct. Lung, vulva. So, these are the common sites of red infarct. Dear audience, again we recapitulate. Infarct is the localized area of ischemic necrosis, either due to sudden arterial occlusion or due to impairment of venous return. The area is called infarct and the phenomenon is called infarction, and the common cause of infarct is arterial occlusion. Now come to what are the factors that influences infarction. Factors influencing infarction. The factors are oxygen content of blood, rate of development of arterial occlusion. So, oxygen content of blood, rate of development of arterial occlusion. Nature of vascular supply, nature of vascular supply. Vulnerability of tissue to hypoxia. Vulnerability of tissue to hypoxia. Another one is cardio, respiratory status of individual. So, the factors are oxygen content of blood, rate of development of arterial occlusion, nature of vascular supply, vulnerability of tissue to hypoxia, and last one is cardiorespiratory status of individual. First come to oxygen content of blood. Dear audience, if oxygen content of blood is diminished, there will be enhancement of infarction. So, enhancement of infarction in diminished oxygen content of blood. Again, if oxygen content of blood is diminished, there will be enhancement of infarction. Now, come to what are the causes of diminished oxygen content of blood. What are the causes of diminished oxygen content of blood? One is hypoxic condition. Whatever may be the cause of hypoxic condition, if the individual is in hypoxic condition, there is diminished oxygen in the blood. Anemia. Dear audience, you know, reduction of hemoglobin per unit volume of blood below the normal level as per age and sex is called anemia. So, in anemia there is reduction of hemoglobin, and you know oxygen is carried in tissue and cell by hemoglobin. If there is reduction of hemoglobin, so tissue and cell will get minimum or diminished oxygen. So, diminished oxygen will enhance infarction. So, in anemia what happens? Decreased hemoglobin. As there is decreased hemoglobin, oxygen carrying by hemoglobin in tissue is decreased. As oxygen carried by hemoglobin in tissue is decreased, so there will be enhancement of infarction. Then carbon monoxide poisoning. Why in carbon monoxide poisoning there is diminished oxygen in the tissue? Dear audience, we know hemoglobin binds with oxygen and forms oxyhemoglobin. When carbon monoxide binds with hemoglobin, it forms carbon monoxyhemoglobin, and carbon monoxyhemoglobin is a bit stable than the oxyhemoglobin. As carbon monoxyhemoglobin is a bit stable, there is slow release of oxygen from this combination. As there is slow release of oxygen from carbon monoxyhemoglobin, tissue gets minimum oxygen. So, there will be enhancement of infarction. Again, carbon monoxide plus hemoglobin, it forms carbon monoxyhemoglobin, and this carbon monoxyhemoglobin a bit stable than oxyhemoglobin. As it is a bit stable, so there is slow release of hemoglobin in tissue. As there is slow release of hemoglobin from carbon monoxide hemoglobin, which is a bit stable than oxyhemoglobin, so tissue gets minimum oxygen and there will be enhancement of infarction. Another one is heart disease. If anybody suffers from heart disease, like cyanotic group of congenital heart disease, there will be diminished oxygen content in blood. So, heart disease like cyanotic group of congenital heart disease, and it will enhance the infarction. Lung disease like COPD, that is chronic obstructive pulmonary disease. If anybody suffers from bronchial asthma, suffers from bronchitis, bronchiectasis or emphysema, these are the COPD. So, COPD is associated with diminished oxygen content of blood and it will enhance the infarction. Now, come to rate of development of arterial occlusion. Rapid rate of development of arterial occlusion enhances infarction. Rapid rate of development of arterial occlusion enhances infarction. Now, come to nature of vascular supply. Dear audience, dual blood supply in tissue delays infarction. Dual blood supply in tissue delays infarction. Now, come to examples of tissue or organ where there is dual blood supply. Examples of tissue or organ, one is lung. There is bronchial and pulmonary supply. There is bronchial and pulmonary supply. Liver, palm of hand, sole of foot. These are supplied by dual blood supply. Now, come to vulnerability of tissue to hypoxia. Respected audience, we know we have some tissue or organ which are very much sensitive to hypoxia, that are very vulnerable to hypoxia, and we have some tissue or organ less vulnerable to hypoxia. Vulnerability of tissue to hypoxia. Brain is very vulnerable to hypoxia. You know, our brain cannot tolerate hypoxia or ischemia for more than 5 minutes. Cannot tolerate hypoxia or ischemia for more than 5 minutes. Then kidney, heart, adrenals, liver. Kidney, heart, adrenals, liver, it can tolerate hypoxia up to 30 minutes, not more than 30 minutes. Can tolerate hypoxia or ischemia up to 30 minutes. Skeletal muscle. Dear audience, our skeletal muscle can tolerate hypoxia or ischemia for up to 1.5 hours or 2 hours. Can tolerate hypoxia or ischemia up to 1.5 hours to 2 hours. So, this is vulnerability of tissue to hypoxia. So, the tissue which are more vulnerable to hypoxia is very much prone to develop infarction quickly. Now come to cardiorespiratory status of the individual. Dear audience, if there is pre-existing cardiac disease or pre-existing lung disease, there will be enhancement of infarction. So, enhancement of infarction. So, enhancement of infarction occurs in individuals with pre-existing heart disease or pre-existing lung disease. This is cardiorespiratory status of individual associated with infarction, that will influence infarction. Dear audience, I have told you today definition of infarct, that is localized area of ischemic necrosis either due to sudden arterial occlusion or impairment of venous return. The area is called infarct and the phenomenon is called infarction. I have told you classification based on color, based on presence or absence of infection. I have told you what are the factors associated with infarction, that is what are the factors that influences infarction. Now, come to, if I want to know what is the shape of an infarct, the shape of an infarct is wedge shaped, wedge shaped. Come to one point, if this is the arterial and if this is the tissue and if this is the venule. Dear audience, I have told you, if there is sudden arterial occlusion, there will be infarction, there will be ischemic necrosis. So, sudden arterial occlusion, leads to infarct. So, sudden arterial occlusion leads to infarct. Dear audience, if there is dilatation, if there is dilatation of the arteriole, what will happen? If this is the tissue and this is the venule. If there is dilatation of the arteriole, what will happen? If sudden occlusion, it will lead to infarct. If dilatation, what will happen? There will be increased arterial blood from the tissue. There will be increased arterial blood from the tissue. So, dilatation of arteriole lead to hyperemia. So, sudden occlusion leads to infarct, but dilatation leads to hyperemia. If the arteriole become narrow, if the arteriole become narrow and remain as narrow, if the arteriole become narrow and remain as narrow, what will happen? There will be diminished blood flow in the tissue for long time, and due to diminished flow of blood in tissue for long time, there is chance of development of atrophy. We know reduction of size of cell due to loss of cellular substances or shrinkage of cell is known as atrophy, and we also know atrophy makes the organ smaller in size, and one of the important cause of atrophy is diminished blood supply. So, diminished blood supply following narrowing of the arteriole or artery for a long time would lead to atrophy, sudden occlusion lead to infarct, and dilatation leads to hyperemia. Dear audience, today up to this, and this is all about the infarct and infarction briefly. Thanks all.